Welcome, First Rich RN here. Today I'm going to show you how to do a Nanda nursing diagnosis care plan using the nursing process, coming up with a SMART goal, a couple interventions, and of course our Nanda nursing diagnosis is. So let's get started. Okay, so here's what we're working with here today. We have this patient, his name is Mr. Smith, he's 79 years old, and he's in for a COPD exacerbation. So as you can see, we're watching him. He looks like he's using some accessory muscles here. He's breathing through his mouth. That respiration rate's pretty high. Our vital signs say it's 34. It's looking like he's having some trouble definitely catching his breath. So definitely some dyspnea going on. Looks like we have a heart rate of 112. Blood pressure is 90 over 165. We have a low oxygen rate of 78% SpO2 and respiration rate of 34. So clearly this is telling us that he is definitely having trouble breathing. We have a high heart rate that's compensating, trying to push more oxygen to the tissues in the body. We have blood pressure helping out too. And then we know he's definitely needing more oxygen based upon the SpO2 of 78. And then we have that respiratory rate of 34, which obviously is trying to compensate, again, trying to oxygenate all of our tissues. So let's go ahead and move to our care plan and see if we can come up with some Nanda diagnosis for this gentleman. All right, so let's look at this care plan here. If we're trying to figure out what's the most important, we always want to start with our actual nursing problems, and we want to start with ABC, so airway, breathing, circulation. Clearly, he meets all of those. So the first one I want to kind of think about is impaired gas exchange. So that's going to be my first diagnosis here. So I'm going to go impaired gas exchange. Now I'm going to go related to disease process, which is this COPD, because that's what's causing it. And then we have to do as evidenced by statement. So we can use various things here, but based upon that low SpO2 of 78, I'm going to put that. So I'm going to go with low oxygen SpO2 less than 90%. Okay, so we could also have chosen as evidenced by altered breathing pattern, as evidenced by confusion if they're confused, as evidenced by hypoxemia due to that low SpO2. So now let's make our goal. So again, for here, we want to use our SMART criteria. And remember, the SMART is an acronym. So S is specific, M is measurable, A is attainable, R is realistic, and T is it timely. So our goal has to meet all of those qualifications. So I want to relate it to that breathing. So let me say the patient will demonstrate ventilation / SpO2 greater than 92% during my shift. Okay, is that specific? Yes. Is it measurable? Yes, because we can do the pulse ox. Is it attainable? Yeah, I think so. Is it realistic? Yep. Is it timely? Can we measure the time aspect? We can, because it's during my shift. Okay, so now let's move down to our nursing interventions. What can I do to help this patient? So one of the things I want to do is I want to assess / monitor my vital signs. That's going to let me know if the patient's getting worse or they're getting better. It's a very important piece, right? Do another one here. How about we can do another assessment / monitor LOC, or level of consciousness. That's important because confusion is a sign of hypoxemia. So a patient's going to be confused if they're having low levels of oxygen. So we're going to monitor that. Okay, how about I do administer oxygen as needed? Okay, so that's going to help me reach my goal, right? So that's a good one. Another one I could do is I could administer prescribed medications. Likely this patient's going to have a duoneb or maybe some solumedrol or some form of steroids. It's going to increase or open up those airways for this patient. So those are all good nursing interventions for this. So now let's go down here and talk about our outcome. So here we just want to state, is that patient goal being met, unmet, or in progress? Well, remember our goal was, will the patient demonstrate ventilation greater than SpO2 greater than 92% of my shift? Well, my shift's not over yet, and so I'm still working on this, so it's going to be in progress. So I'm just going to say goal is in progress. Okay, so that's going to be your first. That'll be our first nursing diagnosis of this care plan using Nanda. So let's go ahead and move forward and see if we can come up with another one. All right, so let's come up with a second Nanda nursing diagnosis for Mr. Smith with COPD. So Mr. Smith is also coughing up a lot of phlegm, which we noticed during our nursing process when we did our first full assessment on him. So a lot of green phlegm's coming out. So how about that patient's having trouble breathing? So they're probably going to be lying in bed, right? So what about at risk for skin integrity? No, definitely not. Hopefully none of you thought of that through that one. Remember, we want actual problems first. So that's an at-risk problem. And we still want to deal with the airway and circulation and breathing. And this patient has multiple NANDAs to pick. So potential for skin integrity, yeah, that can work for some patients, but it's not really going to be working for this patient. And your nursing instructor is not going to want you to put that one when there's actual real nursing diagnosis for you to come up with. So let's stick with that airway process. So I mentioned that phlegm for a reason. So how about we talk about the ineffective airway clearance, okay? So let me write that in here, ineffective airway. All right, now I need my related to statement, okay? My related to excessive sputum production by patient. Okay. All right, now let's do a goal for that. Patient will maintain a clear airway. Now let's test that against our SMART criteria. Is it specific? It is. Is it measurable though? No, it doesn't meet the M. So we have to add something to that. So how about as evidenced by clear lung sounds? Right? Because then we can measure it when we do our assessment. If there's no reduction in mucus assessment, there's a reduction in mucus production, then it's going to be clear lung sounds, then their airway is going to be clear as well. So that's measurable. Is it attainable? Yeah, that's what they're in here for treatment for. Is it realistic? It is. Is it timely? Again, we don't actually have a timely piece on there. So again, let's add it because our statement's not fully developed yet. Patient will maintain a clear airway as evidenced by clear lung sounds by the end of hospital stay. Okay. All right, that works. So now let's go ahead and move on to a nursing intervention. What can we do to help with that goal? How about assess breath sounds? That's an easy one. All right. So excessive mucus production. We want to clear that airway. How about suction the patient as needed? We can do that. Okay, what else can we do? Administer medications as ordered, right? Our duoneb, our steroids, as mentioned before. Okay. Not the best speller, as y'all can see here. Okay, so what about our outcome? Has it been met? Has it not been met? Well, it's still going to be in progress unless they have clear lung sounds, and they haven't developed clear lung sounds. Why will you develop this care plan? So this goal is still in progress. Okay, well, that's 2 Nanda nursing diagnoses for our patient, Mr. Smith here. So hopefully you learned some. If not, go ahead and check out some more of my videos and we'll cover more of these Nanda nursing diagnoses.